There you go.
Okay, so first off, I would start off with patient-focused questions. Have you had any abdominal pain?
Nope.
Any frequency of bowel movements?
Mm-mm.
Or changes in your bowel movements?
Nope.
Are you having difficulty urinating?
Mm-mm.
Any back pain?
Nope.
Genital discharge?
Nope.
How's your sexual health?
Fine.
Okay. All right, I'm going to start by inspecting your belly. So I'm going to draw down your blanket, and the patient has voided. The urine was pale yellow in color, no odor, and it was clear. I'm going to have you flex your legs, your knees just a little bit up like this.
Okay.
Flex your knees. Perfect. All right, and now I see that the abdomen is symmetric. It's normal in color, and I'm going to have you lift up your head. Perfect. I don't see any bulges indicating hernias. And if I had noticed any distension, I would measure the girth with a tape measure later on when I was palpating around the umbilicus. Okay, I don't see any lesions, scars, any striae, and there are normal abdominal movements. The umbilicus is normal in color, position, and contour. All right, now I'm going to go ahead and auscultate, starting at the right upper quadrant. And I should hear normal bowel sounds every 5 to 15 seconds. Okay. And then I will move on to the left upper quadrant, same thing, and the left lower quadrant, and right lower quadrant. Then I would listen for bruits on the aortic artery, and the renal artery, the iliac arteries, and down at the femoral arteries. No bruits. And I would move on to percuss the abdomen, starting with the right upper quadrant, left upper quadrant, left lower quadrant, and the right lower quadrant. And then I would use my fist to percuss the costovertebral angle for tenderness if I suspected any kidney or urinary tract problems. Okay, now I'm going to palpate the abdomen, starting with the right upper quadrant in a light rotating motion, checking for muscle resistance or tenderness, turgor, and checking for a rebound tenderness. And if the client is having any pain, I would check that area last. I'm supposed to be on the right side, but I'm going to palpate the liver, and I would be taking my right hand and my left hand back. So I'm going to have you take a deep breath and then let it completely out. Okay, I'm not supposed to feel the liver. It's usually not palpable. Then I'm going to do the same with the spleen. Take a deep breath and then let it completely out. And I'm going to push into the rib cage and feel for the spleen. Okay, I don't feel anything. All right, go ahead and pause. And I will cover.
Can I click the red line?
Yeah.